Alright, so we will begin with Parkinson's disease. Parkinson's disease is a progressive neurodegenerative disease and it is very common. Parkinson's affects motor ability and is characterized by 4 symptoms referred to as the 4 cardinal symptoms. These 4 cardinal symptoms are tremors, muscle rigidity, bradykinesia or akinesia, which means slow movement or no movement, and postural instability. There is primary or idiopathic Parkinson's disease, and there is secondary Parkinson's disease. Secondary Parkinson's disease symptoms are symptoms that occur from things such as brain tumors or certain drugs. The exact cause of Parkinson's is not known, but it can be familial and environmental. Dopamine and acetylcholine are 2 neurotransmitters. Dopamine is responsible for inhibiting the function of neurons, and acetylcholine produces neurons that transmit excitatory messages that originate in the basal ganglia. Dopamine and acetylcholine are important for coordinated movement. Dopamine is produced in the substantia nigra, and when degeneration of the substantia nigra occurs, less dopamine is produced. With decreased dopamine, there is a decrease in refined voluntary movement. Acetylcholine remains active, which creates the imbalance. Parkinson's disease also reduces the sympathetic nervous system's influence on the heart and blood vessels, and this causes orthostatic hypotension in those individuals presenting with Parkinson's disease. Parkinson's disease has 5 stages. Table 42.3 is on page 867, and that lists those stages, with stage 1 being the initial stage, and stage 5 leading to complete dependence upon others for activities of daily living. When you are collecting everything for your assessment and your history, you want to make sure you know when the symptoms started and when the progression began. Your book mentions that some older adults associate early symptoms of Parkinson's disease with general aging symptoms. We want to assess the patient for resistance to passive movement of extremities. Rigidity is an early sign of the disease process and progresses over time. Rigidity is defined in 3 different ways. We have cogwheel, plastic, and lead pipe. Rigidity that is termed as cogwheel, that defines rhythmic interruption of the muscle movement. Plastic defines mildly restrictive movement, and lead pipe defines total resistance to movement. Clinical manifestations are in chart 42-11 on page 868. A few of those are mask-like face. There's a picture labeled figure 42-1 that presents this. The mask-like face is caused by rigidity of the facial muscles, and this can oftentimes lead to difficulties in chewing and swallowing. Patients can become irritable or depressed because of the manifestations that occur. Pill rolling movement and tremors are significant in Parkinson's disease, along with muscle rigidity and a slow shuffling gait. Speech patterns, they change. Speech pattern changes are very common for individuals with Parkinson's disease. Because of the autonomic nervous system being affected, bladder and bowel problems can occur as well. MRIs can be performed, and cerebral spinal fluid can be tested for low dopamine levels, among other tests. Interventions for Parkinson's disease, there is drug therapy. Dopamine agonists are the most effective in the first 3 to 5 years of use for the individual. Adverse effects such as orthostatic hypotension, hallucinations, and drowsiness can occur. Typically, patients are on Sinemet at some point throughout their disease process. Medication is changed throughout the disease process, and the patient is closely monitored. For many patients that are on a drug regimen long term, they can experience drug tolerance or drug toxicity. Tolerance occurs when the drug therapy is no longer therapeutic for that individual, and toxicity is when the drug is in abundance in the system. Both drug tolerance and drug toxicity are treated by reducing the dosage, changing the drug or frequency of the drug, and drug holidays. A drug holiday is when the patient takes no medication to treat their Parkinson's disease, and a drug holiday typically lasts about 10 days. Physical therapy can be beneficial for patients with Parkinson's disease. Yoga may help with mobility in the early stages. Physical and occupational therapists need to be involved in the care of the patient with Parkinson's disease early in the disease process. As with all patients, you want to encourage individuals to stay as active as they can with their activities of daily living. Speech-language pathologists may have to be consulted for language difficulties. It's important to provide psychosocial support for these patients with Parkinson's disease. Memory deficits are common with patients suffering from Parkinson's disease. Surgery can be done for these individuals if medication therapy is not helping. There is surgery called palliative, and that's when an electrode is placed into the pallidum and a permanent lesion is made in the tissue. A thalamotomy is sort of the same concept. It's for treatment of tremors, and through the thalamus they enter and they use high frequency currents to destroy the brain tissue. Deep brain stimulation is approved for Parkinson's disease. Electrodes are implanted into the brain and connected to a pulse generator, which delivers a current. This current reduces involuntary movements. Fetal tissue transplantation is when human or pig tissue is transplanted into the Parkinson's disease sufferer's brain. There's an improvement of motor symptoms with this in clinical trials, but the treatment is experimental and controversial. We'll move on to dementia. Dementia is when there's a loss of brain function that is progressive. Dementia affects the ability to learn new information and impairs language, judgment, and behavior. Short-term memory is affected, such as paying bills, remembering appointments, remembering to eat. Alzheimer's is the most common type of dementia. Vascular dementia is the second most common dementia and is associated with stroke. When dementia occurs in ages 40 to 50, it is known as early dementia. Microscopic changes of the brain are found in individuals with Alzheimer's disease. Neurofibrillary tangles are classic findings at autopsy. They are tangled masses of fibrous tissue. Neuritic plaques are composed of degenerating nerve terminals and are found in the hippocampus. Beta amyloid are protein deposits found in the plaques in increased amounts. Vascular degeneration is normal with aging, but in individuals suffering from Alzheimer's disease, the degeneration is increased. Vascular degeneration contributes to mortality. Acetylcholine, which is a neurotransmitter, acetylcholine levels are typically low in patients with Alzheimer's disease. The exact cause of Alzheimer's disease is unknown. Age, gender, and family history are important risk factors. Women are more likely to have Alzheimer's disease than men. Patients who have experienced head injuries or repeated head trauma may be at greater risk for developing Alzheimer's disease. Alzheimer's disease can affect anyone that is older than 40, but there's an increased prevalence after 65 years of age. There are no proven ways to prevent Alzheimer's disease or other dementias. I'm going to end this audio before it cuts me off, and I will pick up in the next one.